we're back. I'm Mabel, Jong. You're watching live coverage of the World Healthcare Congress here in Washington, D.C. Thanks so much for joining us. In our studio this morning, Hemi Tewarson, who is Director, Health Division at the National Governors Association Center for Best Practices. Hemi, good morning.
Good morning.
And you'll be moderating a panel a little bit later. What are some of the issues that you'll be talking about during that panel?
Well, it's really great that we're here together, I think, at the World Health Congress, being able to talk about Medicaid specifically, and that's what we're going to talk about later today. We're going to have some two state officials and another Blue Cross Blue Shield representative talking about what are the pressing topics for states, and there's a lot of things for them to think about. In Medicaid on average is 29% of state budgets now. When you think about, the whole panoply of what states have to cover, and they have to balance their budgets, sort of unlike at the federal level, every year, every 2 years. It really is taking up a lion's share of what, both governor's offices and state legislators have to think about. So really asking them kind of what are you going to be our priorities for, because we're hearing from both like red and blue states, how do we drive more value into the program by reducing costs? That is the predominant sort of question and has been for a number of years. So we're going to really dig into what are the different ideas different states are bringing to light in those conversations. What are they trying to do? Where do they see successes and where do they see challenges?
And from where you sit, where are you seeing Medicaid in the priority list for states right now?
It's the top always. It really is the top. I will say along with that is opioids more generally. Medicaid is a part of addressing the opioid crisis, but opioids is also at the top for governors and has been for, unfortunately, a number of years.
Okay.
Yeah.
And are you seeing individual states really doing all they can to roll out the program to the people who need it most?
Yeah, they are, and there's a lot of complications in doing that. There's how do you address new innovation, for example, new drug therapies, new ways to provide care, ensuring access with the number of providers. Like those are all challenges in the Medicaid program. How do you reimburse providers while also making it affordable because you only have so much money in your state budget?
Yes, absolutely.
Yeah.
We see a lot of private companies addressing this, throwing money at the problem, trying to really cost save, but also investing heavily in new technologies to drive the savings in the end.
Yeah.
Are states doing that as well?
They come at it from a slightly different perspective. I think they're trying to understand, okay, there's new innovations. We embrace those. We want to provide those for folks, but we have a limited budget, so how do we afford to do that? Because if you decide to, or you have to, because in Medicaid some of the services are mandatory, if you have to provide new innovations to some patients and it's very expensive, how do you care for the rest of the population with only a set amount of dollars?
What will be,
that's the tension.
Okay, and if you had a crystal ball, I'm sure everyone always likes to use that term, but what do you see happening in, say, 5 years? Where will we be?
Well, that's a good question because a lot can change in 5 years. But I do think states have made some progress in identifying some of the highest cost patients. So there's some folks in the Medicaid program, like the 5% of the population that's really 50% of the spend on average. If you think about small numbers, but yet large expenditures. And who are they? They're folks that sometimes have a whole panoply of needs, like, they may need housing, they may need other social supports, not just, and that's why they're going to the ED over and over again or being admitted to the hospital over and over again and driving the acute care side. So I've seen a real shift in the past number of years, and we've worked for the past 4 years with states on this. How do you address those folks? Really thinking about a broader way of treating the whole person. And I think in 5 years we'll see more progress on that.
Okay.
I think just to talk about sort of history, the last administration was starting to go down the road of thinking through how do we do sort of a better job of thinking about those needs and how do we support states who are really trying to invest in that and figure out where to go. I think there's more interest to engage this administration on that. And, managed care provides a way to do that. Medicaid managed care plans, some of them have already started investing in things like housing, which, pure Medicaid dollars don't pay for, but plans have more flexibility in the way they operate to provide some of those services if they choose to. Right. So I think there'll be some innovations on that front. It'll be interesting to see how far states go. Now, Medicaid can't pay for everything. I mean, let's be clear. Like, they're not going to be the place where you pay for the rent for a person's home and, pay for all of their social services. There's other programs that do that. But how do we have a better partnership and linkage between those other services and Medicaid?
When you moderate your panel a little bit later, what are you most eager to find out?
I'm really interested to talk about this piece and see how states are moving towards that, but I also want to talk about where are they having challenges. So, we're talking about wanting to drive more value into the program. Where do they want to go and they feel like they can't, and why? And what would be the steps that they need to take to kind of move beyond that? The other piece that we've talked a little bit about bringing up in the panel is data. Data is another area where, to make all of these value-based payment changes and delivery system changes, you have to have data that really flows at the plan level, at the provider level, at the state level, and there's a lot of complexities built into that. And so, what are the different states, and each state is in a different place on that, but, how do we think about better designing the system to be more seamless and really effective on that front? Yeah.
And Hemi, how are you finding the conference so far?
Oh, I think it's great. I mean, there's a wonderful lineup of different conversations and different perspectives, which I think is so important in an area as complex as healthcare, because there are so many moving pieces. And sometimes I think, we feel in our role, you're trying to solve for this over here, and an unanticipated consequence, pops up over here. And I feel like that in the opioid crisis. We're in this stage where, trying to limit the number of prescriptions, for example, but then we still have all these folks who are continue to be addicted or continue to have chronic pain. And so what are the other, alternatives we have to address that population? It's not just about, you got to limit, what's happening now with current populations, but then how do you continue to treat them when there's a need? So it's that type of, trying to anticipate all these different changes. The other thing from a state perspective, we're going to have 39 elections.
Wow.
States and territories this November, and 18 have to flip. So we're going to have a lot of leadership change at the state level, and so we are very focused on, supporting, new state leaders that come into office and really have different ideas or similar ideas on how to run their programs and moving forward on a very complex area in healthcare.
Never a dull moment.
Never a dull moment. That's right.
Hemi Tewarson, thank you so much for your time.
Of course. Yes. Thank you.
And I'm Mabel Jong. Thank you for watching. Stay tuned.